Hi, my name is Catherine Ray. We're going to be going over the Anesthesia machine checkoff. You will notice that we will go through exactly the paper checkoff that y'all have on 761, and it's entitled Anesthesia Machine Pre-Anesthesia Checkout. So we'll just go right down the list. Number one, emergency backup ventilation capability. So what that means is that you'll be able to ventilate a patient just in case your machine malfunctions. And to do that, you will need an ANBU, which is located on the back of your machine, back here. And you will also need an oxygen flow meter to attach that to, and you want to make sure that that's functioning properly. And you can see that our ball bearing goes up and down, and so we know that that works. So number one is checked off. Number two is you want to test your low pressure system. So while your machine is still off, we're in the off position, you want to go ahead and whatever air is in the system you want to bleed out. So you want to turn all your flow meters 1.5 turns to the left. And if you noticed just briefly, the flow meter bobbed up and then went back down as all the air left the system. So now you should have no air hopefully left in the system, and now we will get out our bulb suction. It's located in the bottom drawer of most machines. You want to come and identify the common gas outlet on this machine. It's here. It can also be known as the auxiliary common gas outlet, and you can see the attachment will go straight in. You need to switch functioning to the common gas outlet and away from the machine. You do that by a switch. The switch is right here on this machine, and you pull down. You want to deflate the balloon. You're just getting rid of all of the excess gas, and you're trying to set up a negative pressure environment. And once you can deflate the bulb, you want to make sure that it stays deflated for hopefully up to 10 seconds, and this bulb has remained deflated so that it passes this test. While we still have the bulb in place, we also want to make sure there's no low pressure leaks in your vaporizers, and you'll do that by turning them, just cracking on a vaporizer. Your bulb will fill with air. You just need to depress it again, getting all the air out, and same thing, just make sure that it remains depressed. If it fills back up immediately, just keep deflating it until you can make sure you got most of the air out. And as long as it holds a depression, it's passed the test. So that is isoflurane, and then we'll test the sevoflurane vaporizer. Again, we'll repeat the same procedure. Depress the bulb, make sure all the air is out as much as possible, and it will maintain the depression of the bulb, making sure that it's still negative pressure. And that passes the test, and then we'll go on to the, sometimes this one turns on, sometimes it doesn't. There we go. The desflurane, again, the bulb filled back up, but we're just gonna depress it and make sure that it maintains the negative pressure by remaining deflated. And again, this vaporizer has passed. So we are now done with this test. Just disconnect by pulling, put your bulb back in your drawer. Very important step to switch back from the common gas outlet back to the machine. That switch is important to make sure your machine is functional. Now, let's move on to test the high pressure system. What we're gonna first have to do is we're gonna have to go back to the back of the machine. This is usually where you're gonna find your pipelines. Your pipelines are coming from the ceiling, carrying the different gases that we use. They're color coded. The blue is nitrous, the yellow is air, the purple and the white are vacuum, and the green is oxygen. We'll notice that in a minute. Okay, so now we want to disconnect the pipeline, and you do that by twisting and pulling. It'll make kind of a scary little noise. That's just, it's got a lot of pressure behind it. And we're going to leave that on the floor for now. Come back to the front of the machine. Now what you're going to want to do is turn the machine on. And we're going, once the machine is on, we're gonna push the oxygen flush valve, and what we're doing is just bleeding the machine of any oxygen, because we now have no oxygen source, and we're listening for the alarm that's going to let us know that we have no oxygen coming to the machine. That's a very important alarm. And you can listen again to this very distinctive sound. Okay, so now that you've heard that sound, again, we're going to be walking back and forth a little bit. We want to, at this point, turn on the oxygen cylinder. So in the back of your machine, you should have at least air and oxygen. Sometimes you'll have a nitrous tank. You want to turn the oxygen tank on. Remember, every time you want to turn something on, you turn it you turn it to the left. That's lefty-loosey. And when you want to tighten things up, righty-tighty. So we're doing lefty-loosey, opening up the oxygen tank. Now your machine should be getting oxygen from your cylinder. And now that the oxygen cylinder is open, you want to verify that you're getting 1,000 PSI. That just means that you've got a nice full tank, and you can see here that we indeed have over 1,000 PSI. So that's the first part. Now, we also want to test our fail-safe and make sure that our proportional system is working. What this means is the machine is designed so that you cannot or should not be able to deliver a hypoxic mixture. So if you notice, if I go to turn on the nitrous, the oxygen is going to follow no matter what, so that you never deliver a hypoxic mixture. Now, if anything should happen to the oxygen supply, the nitrous should shut off, and we will see that when I go back and I turn off the oxygen cylinder. So righty-tighty, I've turned off the oxygen cylinder, and now if you go back, you should notice that as the machine loses its oxygen, watch the nitrous fall. So, and that's exactly what should happen. So now we again should hear the audible alarm that is signifying that we again have no oxygen coming to the machine. Now you can just stay here, and I'm just going to go hook up the pipeline that we disconnected, and we'll move forward with our test. Sometimes it takes a little elbow grease to get that reconnected. And now that we have oxygen coming back, we should not hear that alarm anymore. With everything running again, with all the pipelines connected, we should look and make sure that all of our pressures coming from the pipelines are between 45 and 55, and they are. And so we verified that. We want to make sure that the flow meters are all functioning properly, that when you turn them, they actually do turn on and off, and they do, so your flow meters are functioning properly. We already tested the proportional system, but again, that's just where if you turn on the nitrous, it will proportionally turn on oxygen so that you do not deliver a hypoxic mixture. And now we're going to make sure that all the flow meters are off. Number 4, we want to check the vaporizers. That entails taking a general look at them, making sure that they're all nice and flat, and that they don't look crooked. That just means that they're seated properly on the manifold. You need to make sure that they are locked into place. If you look way back, you'll see that there's a locking mechanism, and to unlock, you turn it 90 degrees to the right, and it will turn and pop up, and it means it's unlocked. At this point, you can lift the vaporizer off the manifold. If you ever take a vaporizer off the manifold, you have to hold it upright, and just like it is, you can never tip it one side or the other, or God forbid, drop it. I would recommend not taking any vaporizers off the manifold. If there's something that needs to be done, just to call our bio med guy, and I'll just use this moment to show you There's a sticker on every machine, Biomed, Ken, and his phone number. So let's go ahead and lock this down, and you'll notice everybody's got one that you can lock and unlock. So you want to make sure that you cannot turn one vaporizer on while another one is on. That's a protective mechanism. So if we turn on our ISO, we should not be able to turn on SIVO or desflurane, and that is true. And you'll run through and make sure that as one is on, you can't turn the other one's on. And desflurane just keeps sticking, so I'm just going to leave that be. And then this is the opportunity to make sure that your vaporizers are full. So here's a gauge that shows you in the dark how much potent agent you have in your vaporizer. This one's about halfway full, this one's about halfway full, and you can see the max lines. That you don't want to go over the max line of each vaporizer. So moving on to 5, you want to check the vaporizer back pressure. So the instructions are to set your O2 flow meter to 6 liters. So we're going to turn till we achieve 6 liters of oxygen, and then we're going to turn on each vaporizer one at a time. And you don't want this flow bobbin to dip past 5 liters, below 5 liters, or move at all would be nice. So testing it, we're going to turn on the ISO, and if you notice, it barely moved. And we're going to turn on SIVO, and again, it didn't barely move. So it passed that test. And then we are done with that test. Number 6, calibrate O2 sensor. So in every machine, again, it's a different place, and the Estiva is going to be located right here. You just pull down, and you'll see your O2 sensor right here, and you just want to loosen to the left. Remember, lefty loosey, very gently undo it, and then you can just let it hang. And then the rest of this is done on the ventilator settings. The menu looks like 3 pages. It's like a menu. You push it, you'll have the option. You scroll down with the green knob, you highlight setup calibration, selected by hitting the green button, and then you want O2 sensor calibration. Again, scroll down, select highlighted by pushing the green button. We want to, first of all, calibrate to 21%. We've got it open to air so it can calibrate. So all you need to do, it's highlighted, is push the green button. It's saying highlighted start calibration. We'll hit the green button. And you know that you've started calibrating when the machine starts to say calibrating. Now this can take a few minutes to calibrate. So if you want to, this would be a time to maybe lay out some of your anesthesia equipment, or just make sure that you've got a mask, a pulse ox probe, a suction device, some EKG pads. And again, it'll give you the opportunity in this checkout to do that. We're just taking a quick look when you get to the point you can multitask. You can, at this point, make sure that you've got your cables for monitoring, your blood pressure cable, EKG, pulse ox, while you're waiting. Now, you can see we're complete, and we know we're complete because the machine says complete and to reinstall sensor. So we go back down, and you gently place your sensor back in, turning right, righty-tighty, but don't twist it really, really tight. You just want to turn it until it's engaged and leave it alone, because if it's too tight, you can have problems with your machine, and then you just need to shut the door. And we are done with that portion. Now, if you hit the menu button again, we need to test one more, we need to do one more calibration. Sometimes these buttons are hard to push. So you want to highlight setup calibration, select. You want to O2 sensor cal again, select. But this time we want to choose 100%. We want to calibrate 100%. Again, it's highlighted, so select it. And you want to start the calibration, select that. And when you're calibrating, it will tell you it's calibrating, so you know you're doing the right thing. And then, of course, we need to have a little bit of oxygen so it knows to calibrate. All right, so it's just calibrating to 100%. We turned on, we got a little bit of oxygen flowing just so it can calibrate to 100%. We're more than halfway done. This does get easier. And pretty soon, this is gonna say complete. We can move on to number 7. And it's always a good idea from, at any point, come up to the OR, find an empty room. OR 5, OR 14, and OR 15 are the ones with the Anesthesia machine, which is what we're checking off. These rooms may be in a case, which means you can't come in, but if you come in on a weekend or after hours, if OR 5, 14, or 15 are available, grab your buddy or someone and feel free to practice checking off your machine. Okay, so this says complete, so you know you're complete, and all you have to do is just hit menu and you're ready to go with that. Moving on to checking your ventilator, which is number 7. You want to take your breathing bag, also known as your reservoir bag, people call it different things, and attaching it to the elbow. This is the elbow of the anesthesia circuit because it looks like a 90-degree elbow. So what the reservoir bag or the breathing bag is going to act for us is going to act like a lung. So we're just going to keep that there, and following down with flow meter at 0, so the flow meter is at 0. You want to go ahead and turn on your tidal volume and your rate. Now, the manufacturer recommends that when you test this portion, that you have a tidal volume of 400 and a rate of 10. You select this by going to the button underneath, it highlights, and then you can toggle up and down. So when you get to what you want, you just select and it stays. Again, rate, select the button underneath, toggle to 10, select, and now you have your settings. The next step is you will always be on a bag with the hand on the bag. This is a manual breathing. When you want to go to controlled breathing, you need to flip to the bellow sign, which means you flip to the ventilator. So now we're going to give the ventilator a chance to equilibrate, and what we want to see is that what we dialed in, which is 400, is going to be what we get back is at 400, and that takes just a few minutes. And as that's building, you want to, again, but this machine is good to use because you can see your inspiratory and your expiratory flow valves. You want to see them fluttering. Fluttering means that they're not sticking, which means that would be an obstruction to ventilating a patient. So they should be free and fluttery when air is passing through them. And I don't know if we can show you that well enough, but and again, sometimes this can take a minute. So again, I just remember this process can just take a minute for it to get to So what we did was we filled the bellows, and we're just wanting to see that this is in the realm of 400, whatever you dialed in, to make sure that it's approaching 400. We just gave the bellows a little help with the oxygen flush valve. So now that you can see after a couple of breaths that it's doing a nice job approximating what you've dialed in with what you're getting back with your flow meter at 0, the next step is to increase your flow meter to 5 liters output, and you want to make sure that you do not have a significant change in your tidal volume. And if it does go up a little bit, that at least comes back down to baseline. And while we're waiting and looking at that, we want to also be looking at the manometer and making sure that after each breath that it is returning to baseline. And it is. We just, so that it's not experiencing a sustained pressure. So as you can see, we've essentially come back down to baseline, even with increase in your oxygen flow, which is what you wanted to see. So that is the end of the ventilator check. So what we'll do is we'll switch back to bag, and we will remove our reservoir bag, put it back, and then we're ready to go for the next portion of our checkout. Now we want to check the breathing circuit. The breathing circuit, you want to make sure that it can hold positive pressure, because you want to be able to positive pressure ventilate a person. So for right now, we want to take your APL valve, and APL valve says just that at the very top, APL. You want to put it on 30 centimeters of water pressure, and then you want to occlude the Y. You may see people hold it and occlude the Y, but properly done, there's a place on every machine. This machine has it right here where you can secure the Y, occlude the Y, and then you want to give it a little oxygen flush, and you're looking at the manometer, and you just want to make sure that it can hold the pressure at around 30. And we'll just get it back up there and see, hopefully if it stays and doesn't fall too significant. And you can see it does. It holds the pressure at 30, so it passes that test. So at this point, you can relieve the pressure off the bag. You can take that off the machine, open up the Y again. And if you noticed the volume, the apnea volume alarm, it just means that your patient is apneic. I'm gonna be quiet and let you listen to it. Again, that alarm just lets you know that your patient is not being ventilated, and you'll even see the words volume apnea and how long they've been apneic. And so we just verified that alarm. Number 9 is the scavenging system. You want to make sure that that's functioning properly. It's usually located on most machines to the left. Some of it's completely internalized. Others, you may have small things that you can look at to verify functioning. We can see that the ball bearing should be floating in the green zone, meaning there's just the right amount of suction being applied to the scavenging system. And then also you want to make sure that scavenging is connected. Scavenging again is the vacuum, because it's vacuuming gases away so that they don't pollute the atmosphere. So the vacuum again is either a white or a purple pipeline hose, and that is connected. While we're down there, we want to inspect our CO2 canisters, making sure that they are white. First of all, that they're there, that they are white and not exhausted, which would show up in a purple color. These have a little bit of purple, but normally they should look all white, such as these, both of them. So the last part of this is number 11, just making sure that you're ready for your anesthesia case. That's going to entail making sure that your suction is working, that you have suction and that it is working. You want to put your thumb over it to make sure you can feel some suction. Make sure that you have a suctioning device, but it has to remain in its package. Again, this would be a good time to make sure your monitor is on, that you've got your monitoring cables available, that you have what goes on the end of the monitoring cables but not out. Keep your pulse oximeter in its package, as well as the EKG. The patient should come with a blood pressure cuff on. And then even your mask has to remain in its package. Because we've manipulated a lot of the controls, you want to verify that you've got the machine on bag, ready to ventilate a patient. You want to make sure that your APL is all the way open so that you don't have pressure on your patient when you go, when they start to breathe. When you're pre-oxygenating them. And just emergency airway supplies, which would be an ET tube, the correct size blade and handle, oral airways, tongue blade, anything that you would need to secure an airway once your patient is induced. And that concludes our machine checkoff.